Imagine a world where the risks of chemotherapy could be significantly reduced simply by understanding a patient's unique genetic makeup. This is no longer just a distant dream, but a promising reality. And here's where it gets truly groundbreaking. Recent research from the University of Pennsylvania demonstrates that pharmacogenetic testing can dramatically lower the chances of severe adverse reactions in gastrointestinal cancer patients. This approach not only speaks to personalized medicine's potential, but also raises important questions about healthcare practices and how quickly innovations can be adopted. In a study recently published in JCO Precision Oncology, scientists revealed that genetic testing designed to identify patients with certain gene variants can help prevent life-threatening side effects caused by standard chemotherapy drugs. The research focused on two specific genes involved in how the body processes common chemotherapeutics, especially fluoropyrimidines, like fluorouracil and capecitabine, and irinotecan, a drug often used for gastrointestinal cancers. Some individuals carry variants in these genes that slow or even halt drug breakdown, increasing their risk of dangerous reactions. One such gene is known for encoding the enzyme dihydropyrimidine dehydrogenase, DPYD, which plays a key role in metabolizing fluoropyrimidines. Approximately 8% of the population has variants that impair this enzyme's activity, risking severe toxicity. The other gene, UGT1A1, affects how the body processes irinotecan. Variations here can also lead to heightened side effect risks. The study involved screening 288 patients from 3 Penn-affiliated oncology clinics for these genes before starting treatment. Among these patients, 11 carried DPYD variants, and 8 of them received a tailored, reduced dose of fluoropyrimidines based on their genetic results. Similarly, 39 patients with UGT1A1 variants received adjusted doses of irinotecan. Most of these modifications happened before treatment even began, allowing doctors to make safer, more precise choices. Now, here's the compelling part. When comparing these tested patients to a larger group whose treatment was not guided by genetic testing, the benefits become clear. In the untested group, a staggering 65% experienced severe side effects that required urgent medical care or hospitalization. But for the genetically tested and dose-adjusted group, only 38% faced serious adverse reactions, a rate comparable to patients without these genetic variants. Moreover, the tested group was less likely to need changes or halt their treatment altogether. Despite the clear advantages, the integration of DPYD testing into routine clinical practice has lagged behind, even though it's recommended by major regulators like the FDA and European Medicines Agency. The delays stem from uncertainties among healthcare providers on how best to incorporate genetic insights into treatment plans, coupled with logistical hurdles, such as turnaround times for test results, difficulties in linking lab data to electronic health records, and a general lack of familiarity with how to interpret and act on genetic information. The authors argue that successful adoption requires a multi-layered approach, improving laboratory processes, encouraging doctors to order tests early in treatment planning, implementing reminder alerts within healthcare systems, and providing thorough education to help clinicians make informed, confident decisions. They emphasize that more comprehensive testing, looking at multiple relevant genes, can greatly reduce the risk of severe side effects, especially given that drugs like fluoropyrimidines and irinotecan are often prescribed together for gastrointestinal cancers. And here's the thing, this research highlights a vital shift towards personalized medicine, where genetic insights are used to tailor treatment to each individual's unique biological profile. Still, many clinical workflows overlook testing for multiple genetic markers simultaneously, missing out on a powerful opportunity to enhance patient safety. Does your healthcare system prioritize such genetic testing, or is it still on the horizon? Would you agree that integrating pharmacogenetics more deeply could revolutionize cancer care? Or do you see practical barriers preventing widespread adoption? Drop your thoughts below. These questions are just the tip of the iceberg in the evolving landscape of personalized oncology.